Can a stroke be predicted? 7 early warning signs you need to know. Did you know that a stroke can be warned about a month in advance? Many people think strokes happen suddenly. But in reality, the body often sends warning signals that we unknowingly ignore. If you recognize these signs in time, you can prevent a dangerous stroke and even save yourself or a loved one. Stroke is one of the leading causes of death and disability worldwide. Every year, millions of people suffer severe consequences from this condition. However, few people realize that before a stroke actually occurs, the body tries to warn us through small but crucial symptoms. These signs can appear days or even weeks before a stroke strikes. So how can you recognize these warning signals? Are you overlooking important signs from your body? In today's video, we will explore 7 early warning signs of stroke, how to identify them, and most importantly, how to prevent this life-threatening condition. Pay close attention, and don't forget to share this video with your family and friends, because a small action today could save a life in the future. Let's get started. 1. Prolonged high blood pressure. The leading risk factor for stroke. High blood pressure is one of the primary causes of stroke. When this condition persists, it can damage blood vessels, weakening their walls and making them more prone to rupture. Stroke caused by high blood pressure typically occurs in 2 main forms. The first is ischemic stroke, the most common type. This happens when a blood clot or plaque buildup in an artery blocks blood flow to the brain. When the brain doesn't receive enough oxygen and nutrients, brain cells begin to die, leading to severe damage and even death. The second is hemorrhagic stroke, which is less common but more dangerous. When blood pressure spikes too high, blood vessels in the brain can rupture, causing bleeding in the brain. The leaked blood compresses brain tissue, destroying nerve cells and leading to severe consequences. People with prolonged high blood pressure may notice warning signs such as frequent headaches, especially in the morning, due to increased pressure in the blood vessels. Shortness of breath, even while at rest, may occur as the cardiovascular system struggles to cope. Irregular heartbeat, whether too fast or too slow, indicates that the heart is under significant strain. How to prevent high blood pressure and reduce stroke risk. Regularly monitoring your blood pressure helps detect abnormalities early. Reducing salt intake, avoiding processed foods and fast food, and increasing the consumption of vegetables and fruits are crucial preventive measures. Managing stress through relaxation activities, meditation, or light exercise is also essential. Maintaining an active lifestyle, with at least 30 minutes of exercise per day, improves blood circulation and stabilizes blood pressure. If necessary, follow your doctor's prescribed medication and treatment plan. High blood pressure can silently damage blood vessels for years before leading to serious consequences. Therefore, don't overlook this risk. Take preventive measures today to safeguard your health and that of your loved ones. 2. Unexplained fatigue. A warning sign of stroke risk. Prolonged fatigue with no clear cause can be an early warning sign of stroke. Yet it is often overlooked. When arteries become blocked, blood flow to the brain decreases, preventing the body from receiving enough oxygen and essential nutrients. This reduces brain function, leading to persistent fatigue. One particularly concerning cause of this condition is a transient ischemic attack. This occurs when blood flow to the brain is temporarily disrupted due to a small blood clot blocking a blood vessel. Although symptoms usually disappear within minutes or hours, this is a warning sign of an actual stroke in the future. Research shows that approximately 30% of people who have experienced a transient ischemic attack will suffer a stroke within a year if preventive measures are not taken. Persistent fatigue may come with other warning signs. Feeling exhausted despite having enough sleep is one of the most common symptoms. As the body struggles to recover even after adequate rest, cognitive function and concentration may also be affected, making individuals easily distracted or forgetful. Additionally, some people may experience a sudden loss of energy, feeling completely drained without any clear reason. If this fatigue is accompanied by dizziness, headaches, numbness or weakness in the limbs, or difficulty speaking, the risk of stroke becomes significantly higher. How to recognize and prevent it. If you notice unusual fatigue, especially when accompanied by other symptoms, it should not be ignored. A medical checkup to monitor blood pressure, cholesterol levels, and cardiovascular health is essential. Additionally, a healthy lifestyle plays a key role in stroke prevention. A balanced diet with reduced salt intake and limited processed foods helps maintain stable blood pressure. Regular exercise improves blood circulation, while stress management, adequate sleep, and maintaining a relaxed mindset contribute to overall health. Fatigue can be a common symptom, but if it persists without a clear cause, it may be a warning from your body. Do not wait until it is too late. Take action today to protect your health. 3. Vision problems, a dangerous sign of stroke. Sudden and unusual changes in vision can be an early warning sign of a stroke. When arteries become blocked, the supply of oxygen and blood to the eyes and brain decreases, leading to vision problems. Many people may dismiss these symptoms as simple eye strain or aging effects. But in reality, they could be serious warning signals from the body. There are several key signs to watch for. Sudden blurred vision may occur without any clear reason, making images appear hazy or difficult to see. Some people experience double vision, where two overlapping images make it hard to focus. Another alarming symptom is temporary vision loss, where one or both eyes suddenly lose sight for a few seconds to minutes. This could indicate a transient ischemic attack, a warning of an actual stroke. Additionally, some individuals may notice flashes of light or dark spots appearing in their vision, disrupting normal sight. These issues can appear suddenly and disappear after a short time. But this does not mean the body is safe. In fact, they are critical warnings that blood flow to the brain is compromised and needs immediate medical attention. If you experience any unusual vision problems, the most important action is to see a doctor immediately. Do not wait for the symptoms to go away on their own, as this could cause you to miss the golden opportunity to prevent a stroke. Additionally, checking blood pressure, cholesterol levels, and other cardiovascular risk factors such as diabetes or heart disease is essential. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and stress management, also plays a crucial role in protecting overall health. Vision is one of the most vital human senses. If you notice any sudden changes, listen to your body and take timely action to protect your health. 4. Severe headache, a warning sign of stroke. Headaches are a common symptom, but when they occur suddenly, intensely, and without a clear cause, they could be a serious warning sign. In many cases, severe headaches are associated with hemorrhagic stroke or ruptured brain aneurysm, both of which can be life-threatening if not treated promptly. Hemorrhagic stroke occurs when a blood vessel in the brain bursts, causing blood to leak into surrounding tissues, increasing intracranial pressure, and damaging brain cells. This condition is often linked to high blood pressure or weakened blood vessel walls. On the other hand, a ruptured brain aneurysm happens when an artery bulges excessively and cannot withstand the pressure, leading to bleeding in the brain. If not detected and treated in time, both conditions can result in severe complications, including death. Warning signs may include a sudden and severe headache, often described as feeling like a thunderclap or the worst headache of your life. The pain may be accompanied by nausea, unexplained vomiting, and sensitivity to light. Some individuals may also experience neck stiffness, seizures, confusion, or even loss of consciousness. If these symptoms appear, immediate emergency medical attention is crucial, as every passing minute increases the risk of permanent brain damage. To prevent stroke and brain aneurysm rupture, it is essential to control blood pressure, especially for individuals with a history of hypertension. Maintaining a healthy lifestyle, managing stress, following a balanced diet, and engaging in regular physical activity can significantly reduce the risk. Additionally, regular health checkups are vital for detecting early warning signs within the body. Do not ignore severe headaches, as they could be an important warning from your body. Taking timely action could save your life or the life of a loved one. 5. Numbness or weakness on one side of the body, a key stroke symptom when a part of the brain is damaged. Numbness or weakness on one side of the body is one of the most characteristic signs of a stroke. This occurs when a part of the brain is damaged due to a lack of blood flow or hemorrhage. When blood flow to the brain is disrupted, nerve cells in the affected area are quickly damaged, leading to a loss of motor control and sensation on one side of the body. Common symptoms include sudden numbness or weakness in the face, arm, or leg, particularly on one side of the body. The affected person may struggle to move their arm or leg or have difficulty gripping and holding objects. In some cases, facial muscles are affected, causing a drooping smile or one side of the mouth to sag. These symptoms may appear briefly and then disappear or gradually worsen over time. When noticing these warning signs, it is crucial to perform the FAST test to assess the risk of stroke. First, observe the person's face and ask them to smile if one side droops. It may indicate a problem. Next, ask them to raise both arms if one arm drifts downward or cannot be lifted. It is a strong warning sign. Then, check their speech by having them repeat a simple sentence if their speech is slurred, garbled, or difficult to understand. The risk of stroke is high. If any of these three signs are present, immediate action is necessary, as time is a critical factor. Every passing minute during a stroke increases brain damage and the risk of permanent disability. Therefore, if these symptoms are observed, call emergency services immediately to ensure timely treatment. Preventive measures such as controlling blood pressure, maintaining a healthy lifestyle, and regular health checkups are the best ways to reduce the risk of stroke. 6. Dizziness, loss of balance, and confusion, a possible stroke warning. Dizziness, loss of balance, and confusion can be early warning signs of a stroke when blood flow to the brain is disrupted, impairing motor control and cognitive functions. The brain requires oxygen and nutrients to function properly, and when circulation is interrupted, essential abilities like movement coordination and spatial awareness are affected. A person experiencing a stroke may suddenly feel dizzy, lose balance, and stumble, even if they were completely fine moments before. A sense of disorientation, an inability to control body movements, or unexplained lightheadedness are also serious indicators. In some cases, the individual may feel nauseous or vomit for no apparent reason, accompanied by confusion, difficulty concentrating, and slowed reactions. If these symptoms appear alongside others such as a severe headache, blurred vision, or numbness and weakness on one side of the body, the risk of stroke is even higher, and immediate medical attention is required. Do not assume that these symptoms are just due to fatigue or lack of sleep, as delays in treatment can lead to more severe brain damage. If a stroke is suspected, ensure the person sits or lies down safely to prevent falls, and call emergency services immediately. Acting quickly can save a life and reduce the risk of permanent disabilities. 7. Difficulty speaking or understanding speech, a critical sign of stroke. Difficulty speaking or understanding speech is one of the key warning signs of a stroke, occurring when the part of the brain responsible for language is affected. When blood flow supplying oxygen and nutrients to this area is disrupted, the ability to express and comprehend language is severely impaired. Symptoms can manifest in various ways. Some individuals struggle to speak. Their speech becomes slurred, unclear, or distorted. They may attempt to communicate but find it difficult to choose the right words, or their sentences may not make sense. Conversely, some people may still be able to speak but have trouble understanding what others are saying. Even with simple sentences, this can lead to confusion, frustration, and slower responses than usual. This condition often appears suddenly and may be accompanied by other stroke symptoms such as numbness or weakness on one side of the body, severe headaches, or loss of balance. If you notice someone having difficulty speaking or understanding speech, try asking them to repeat a simple sentence if they are unable to do so or their speech is unclear. It is a serious warning sign. In this situation, do not hesitate or ignore the symptoms. Call emergency services immediately to ensure the patient receives timely medical intervention. Treatment during the golden hour, the critical period right after a stroke occurs, can significantly reduce brain damage and improve recovery chances. Recognizing the signs early and acting quickly is the key to saving lives and minimizing long-term consequences. Stroke prevention is essential for protecting health and maintaining quality of life. A stroke can occur suddenly, but its causes are often related to long-term lifestyle and health conditions. Taking preventive measures now can significantly reduce the risk of stroke. Controlling blood pressure and blood sugar is the first and most important step in preventing stroke. High blood pressure is the leading cause of blood vessel damage, which can lead to blockages or ruptures in the brain. High blood sugar from diabetes also increases the risk of atherosclerosis, narrowing blood vessels and affecting blood circulation to the brain. Regularly monitoring and managing these indicators will help maintain a healthy cardiovascular system. Maintaining a healthy weight and exercising regularly helps improve blood circulation, reduce pressure on the heart, and prevent risk factors for stroke. Light exercises such as walking, swimming, yoga, or cycling for at least 30 minutes a day can help lower blood pressure, improve heart health, and effectively control weight. A healthy diet plays an important role in reducing the risk of stroke. Limiting the consumption of salt, sugar, and processed foods will help control blood pressure and prevent cardiovascular disease. Instead, increase the intake of vegetables, fruits, fatty fish, whole grains, and fiber-rich foods to support blood circulation and protect vascular health. Additionally, quitting smoking, limiting alcohol consumption, and reducing stress are crucial factors in preventing stroke. Nicotine in cigarettes can constrict blood vessels, while alcohol increases blood pressure and disrupts circulation. Prolonged stress can also negatively impact the nervous and cardiovascular systems. Maintaining a relaxed mindset through meditation, listening to music, or engaging in leisure activities can help improve overall health. Finally, getting enough sleep and having regular health checkups also play a crucial role. Poor sleep can increase the risk of cardiovascular disease, high blood pressure, and stroke. Regular checkups help detect early risk factors, allowing timely intervention to protect health. Stroke is not inevitable and can be prevented if we take proactive measures to protect our health. Recognizing early warning signs and acting promptly can make the difference between survival and permanent damage. Pay attention to yourself and those around you. Maintain a healthy lifestyle. Control risk factors, and do not ignore any unusual signs. A timely decision can save your life or that of a loved one. If you found this video helpful, don't forget to like and share it so more people can access this important information. And subscribe to the channel to not miss future useful content. Thank you for watching, and see you in the next video.